Hi everyone, this is my presentation on my clinical reflection. My name is Emily Bonser, and I will be going over all of the objectives that I met throughout this semester. I'll be talking about how each of my clinical experiences relates to these and which experiences met the objectives for this course. I'll also be discussing a little bit of my research and ethic articles that I've done. So, my first objective is to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. I definitely experienced this objective when I was teaching the students in 309 peer leadership. I taught them a lot about like just collecting vital signs, how to advocate for their patients, I remember specifically I was teaching a student how to apply creams to pressure sores and how to really make sure that the whole area was covered and apply a generous amount of the cream, and really educating them on the importance of that. And I also exhibited this through my manager experience when we walked around the unit and were just assessing the general needs of the unit and what the nurses needed from us, and just a really great prioritization concept that we were able to exhibit. I also exhibit this during the flu clinic, and using my general knowledge of the muscle anatomy was really uh, useful. And then also talking about the epidemiology of the flu vaccination and how important it was to get it. For objective number 2, apply basic principles of management to meet the challenges of an ever-changing healthcare environment. I definitely met this at Emmaus High School when we were doing the biometric scans. This was a very hectic environment. There was a lot of high school students that we had to filter through, um, including some special students with special needs. And it was very difficult to manage all of the students all at once. And just to get them even to like form a straight line was a very difficult task. And we really had to manage them a lot. We developed a really great system actually and had it flowing very nicely. And then we realized that some of the students weren't filling out their cards fully. So me and another student actually went through and checked all of the cards to make sure that they were up to date and that they had all of the information on that we needed from the students. We ended up making two different piles, one with the good cards that had everything, and one set with cards that students needed to follow up on. And I felt like that was really great management because we were able to do that and everyone else was able to still filter through the students and have a really great setup to get through all of our students that we needed to in such a short time frame. But I thought that was a really great management experience for me. And then I also exhibited this objective through my manager shadowing and supervisor shadowing. When I shadowed the ICU manager up at Carbon, we talked a lot about management and the resources that she uses and the different resources that she can give her staff to use to help manage themselves a little bit, and such as the charge nurse. She also went on a meeting and discussed management meetings, and really just helped clue me into what they were talking about and all the different aspects of management. And I thought that was a really great experience. It helped me a lot to learn about management and just really discover what all goes into it and definitely get a better appreciation for it. The supervisor experience was also a really great opportunity to meet this objective because we were managing the entire hospital at St. Luke's Allentown, and it was very hectic to say the least to manage all of the RNs and all of the PCAs, especially with things consistently changing. Um, she showed me the sheet that was, she called it like their Bible, but it had all of the staffing needs of the RNs and PCAs on the units, on every single unit, and it was very complex, to say the least. It was kind of hard to figure out, and she was able to use it flawlessly. And I felt like it was really eye-opening the amount of management that goes into supervising an entire hospital, and it's a lot to take in. And she also was on a management meeting about with all the different supervisors from all of the campuses across the St. Luke's network, and just hearing the number of RNs and PCAs that some of them needed, such as Bethlehem, such a large amount of RNs and PCAs were needed just for that night alone that they didn't have in order, and it was a complex situation that needed a lot of management to figure out and where to move people, which units could probably have a little less people, which units could have more, and it could all change throughout the night too. Like, well, we had a critical case come into the emergency department, and the ICU was going to get put with another person, and therefore would need another RN, and we had to call somebody else in, and it was just a really complex management situation that I thought was great to really observe and learn about. On to my next objective is 3, which is demonstrates leadership skills through effective use of communication by representing self, the college, and nursing in the professional manner. I felt like I really exhibited this throughout all of my clinical experiences. I always try and be very respectful and hold myself in a very professional manner. I will say this is highlighted during my shadowing experience for my ICU manager, because I work on the same floor. I'm just across the hall in the med-surg unit where I normally work, and my managers did come over to discuss a management issue with her. And when they saw me, they commented on how professional I looked and how I looked really great and professional in the nursing environment. And I felt very professional in that moment and felt as if I represented myself in Cedar Crest and very well towards my managers. And I felt like they had a very good understanding that it was a very professional role that I was in at that moment. So I felt like that just highlighted my professionalism. And objective number 4, critically evaluate and disseminate current research related to the principles of leadership and the effects on healthcare system. I really felt like my continuing education on mental health, the podcast that I watched, I believe it was number 2 on mental health, was really great research that it had in there on the amount of patients that each psychiatrist kind of had to take on, and the need for a lot more psychiatrists, because it's an overwhelming majority of people do not have one, or difficult to find one that fits in their schedule, just because there's a lot of people with a lot of complex mental health needs that need a psychiatrist full-time. I also met this objective through my research, and my research article is on pressure ulcers. It is a article that I decided to do based on my clinical experience for peer leadership during my 309. We went down to an educational meeting and we talked about pressure ulcers and how to prevent them. We talked about Juven, which is a really great drink that helps prevent them. We learned about the different devices such as the gel rolls, the tortoise, and the pull sheets to get the patients up in bed and prevent them from getting shearing friction ulcers. And I thought that was just a really great presentation, and I figured it was a very large prevalence of ulcers, so I wanted to get a general understanding of the prevalence of how many ulcers there is, and it is quite staggering how many patients in an acute care setting have pressure ulcers. Onto objective number 5, a function as a component of patient advocate, nurse advocate, and change agent. I felt like I exhibited this objective during peer leadership because I really pushed my students that I was helping to advocate for their patients and really had them advocate for them and their patients. And I also felt like I met this objective through my blood pressure clinics. At the Rodell Aquatic Center, I made sure to advocate for my patients, well, the people that came in there, and really praised them for coming in and swimming to help lower their blood pressure, and said that it was a really great activity for them. And I really educated them on the importance of getting their blood pressure checked if they don't normally get it checked, and the importance of adhering to any medications that their doctor prescribed. I also think that I really met this objective through my blood pressure clinic at the church, because I really did a lot of stress management education, and I really educated on the importance of blood pressures and stress management and how to lower blood pressures. I feel like this was a really great objective, and that I really met this through my blood pressure clinics. And I remember I had a really great conversation with somebody who was struggling with his blood pressure for a long time and finally found the right medication there and really adhered to his medication. And that was great. And I got to advocate for him and tell him how great he was doing and just praise him basically for really listening to his doctor and getting his blood pressure checked out. Objective number 6 is formulate plans for continued personal leadership growth and development as an independent practitioner of the nursing and contributing member of society. I felt like this was really met throughout a lot of my clinical experiences as I saw things and kind of decided what kind of nurse I was going to try and be. I felt like my shadowing experience with my nurse manager was really great because she was really great with her patients and stuff. I remember specifically we had a patient that we literally had just walked into the room to answer a call light, and she had just gotten news that she had gotten cancer, and the news was like very fresh to her, very new, and she was crying, and the nurse manager did a really, really wonderful job of comforting her. She hugged her and really talked her through it, and I thought that was great, and it really gave me insight as to what kind of nurse I want to be and how I'd like to comfort and care for my patients throughout any circumstances that they face. I also met this objective through my Good Shepherd experience. During my Good Shepherd experience, I saw a lot of really, really detrimental cases, a lot of pediatrics patients that just had the worst possible things happen to them, and it really made me realize that I wanted to go into critical care, and I really wanted to be the best nurse that I could and help them, and I really wanted to continue my education and get more and more certifications and more licenses just to really help care for my patients in that sense and just know all of the things to do for my patients and care for them in the future. Objective number 7 is recognize the roles of the nurse in policymaking related to healthcare services at the local, state, and national and global levels. I really met this objective in Harrisburg when we talked to our 2 presenters. I remember afterwards we went and talked to the one presenter about marijuana laws and how nurses can get involved in this. We talked a lot about how much power nurses really do have in policymaking, and it's really eye-opening and enlightening, I'll say, to know that we do have a lot of power to change anything that needs to be changed in the healthcare system. So I thought that was really great, and I think I met this objective pretty well during that trip. Objective number 8 is to predict and describe potential ethical dilemmas within the clinical, organizational, and professional nursing practice. I felt like I really met this objective through my continuing education on the one podcast. I think it was number 4. It was on ethical dilemmas that nursing students and faculty face. And I felt like that was a really, really great article that discussed a lot of ethical challenges that we do face and that I related to personally. I also met this objective through my ethical article. That is on whether a physician should have the power to reverse a surrogate's decision on a full code status and to make the patient a DNR and restrict that CPR access. That was very ethically stimulating, and I actually also referenced the leadership book that we have for our class to really dive into those ethical principles of non-maleficence and autonomy, which are really discussed in this article. And I felt like I really met my objective through that. Thank you for listening to my presentation, and I will